Hello and welcome to our webcast, How to File FEMA Applications, COVID-19 and Future Disasters. We're pleased that you've joined us today. And before we begin, I'm going to play our housekeeping video.
Welcome and thanks for joining. We're pleased to present our continuing professional education webcast series. Before we begin, please keep the following in mind. You can customize how you view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can adjust window size and placement or enter full screen mode using the controls at the top right of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons that relate to a different aspect of our session. You can download a PDF of today's slides from the Slide Deck and Handouts widget. You can ask questions by typing in the Q&A window and clicking Submit. We'll do our best to answer all questions or follow up via email. If you experience technical difficulty, refresh your browser by hitting the F5 key. Today's session offers 1 CPE credit. To receive credit, you must meet the National Association of State Boards of Accountancy requirements. You must attend at least 50 minutes of the session and respond to at least 75% of polling questions. To participate in the polls, please check the button next to your answer within the slide window and click Submit. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget and download your CPE certificate. Don't worry if you can't download your CPE certificate today. We'll email you a copy in 2 weeks. If attending this webcast in a group, you must complete our group CPE attendance sheet, available in our Slide Deck and Handouts widget to receive credit. Please have all group members sign it and send only 1 sheet per group. CPE credit can only be awarded to participants registered as themselves and isn't available for participants who view the on-demand version. This presentation is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
All right, and now I would like to introduce today's presenters from Moss Adams. We have Georgia Green, manager, and Kimberly Sokoloff, partner. Their bios and contact information are located in your webcast console for your convenience. And now I would like to turn it over to Georgia to get the presentation started.
Thank you so much, Amy, and welcome everyone who's here today. Thanks for joining us. Today we're going to talk about FEMA. We'll get started talking about prevention and hazard mitigation. We'll talk about some of the key terminology you'll need to know, the application timelines and timing, both looking at COVID disaster and other, what I'll just call normal disasters, and then really kind of dig into the different aspects of a FEMA application, eligible expenses, the documentation you need, how contract procurement works, a thorny subject called duplication of benefits, and wrap it up with some pro tips, basically things I've learned along the way. And then I'll hand it off to my colleague, Kimberly Sokoloff, who's going to talk about audit considerations and her pro tips as well. Basically, the genesis of this webcast comes from the work that I've been doing, our teams have been doing with clients who are doing FEMA applications over the last few years, and just thinking about, what have we learned? What would be useful to share with the world? I know a lot of you are still working on these, and also just looking forward into the future, that, knowing that more environmental disasters are probably on the way. I hate to say it, but it's true. So, just how do we prepare for that? How can we be best prepared to respond to those and to, apply for FEMA funding if and when the time comes? Hopefully not, but you want to be ready for that. So a little bit of a disclaimer to start with. Guidance has changed frequently throughout the pandemic. Also guidance, just FEMA guidance in general for every disaster is going to be unique. So, while some of what we're talking about here is very relevant for COVID, there might be other information that's relevant if a tornado hits a building, or in a winter storm, there's going to be some other specific guidance for that. These are some of the highlights, things I think are very relevant. It's not supposed to be every fact, everything you need to know about public assistance, but definitely some of the key points here. Definitely recommend you seek consulting support and get personalized guidance for your unique situation. And of course, work with your legal counsel as appropriate. Most of my clients have not needed to work with legal counsel to do FEMA applications, but there could be circumstances that warrant that. So just keep that in mind. And also we have links to FEMA's guidance throughout the presentation. This is what's current as of today, but you always want to look for the most current guidance, and that can be found on FEMA's website and also in the FEMA grants portal. So we're just going to kick it off right now with our first polling question. Amy, will you read the question for us?
All right, thank you. So the polling questions are located right on the slides that we're presenting. So if you can't see that, just please try hitting the F5 key to refresh your console. So the first one is to get a feel for our audience. It's what type of organization do you represent? Hospital, skilled nursing facility, other healthcare entity, state, local government entity or district, tribal government, or NA. And to respond, you're going to click the button next to the answer you choose and hit the submit button.
And while you're doing that, I just want to point out that we have a Q&A chat box. So if you put your question in there, we'll be the only ones who see it. The whole audience doesn't see it, but we'll be able to either respond back to you in writing, or if we have a little time during these question breaks or at the end of the webcast, I'll try to answer questions that come up through the Q&A box. So yeah, please feel free to use that liberally. Okay, excellent. So I see looks like more than half in the audience are with hospitals today. So very good, thank you. And that makes sense. That's been a lot of the work I've been doing for the past few years, is working with hospitals through the COVID disaster. So I just want to start with this notion from Benjamin Franklin, one of my personal heroes, that an ounce of prevention is worth a pound of cure. FEMA is very focused on prevention and preparedness and hazard mitigation. So to them, that means, you know, building things better than they were when a disaster happens. It's not just rebuilding exactly how it was, but maybe trying to improve on things. If your facility is in a place where you feel like there are environmental threats in your region or to your facilities or your whatever it is, if you're a city or state, maybe it's utilities or governmental buildings, it's really worth thinking about, are there engineering controls we could put in place or technological improvements we could put in place? And is FEMA a potential source of funding that could help us do that? There are funding sources that are, you know, through FEMA, through your state emergency management agency, that are competition based, that could be helpful. Whether that's, you know, stabilizing a hillside that maybe could be subject to mudslides, or doing some fire, you know, wildfire mitigation, those kinds of things. FEMA does do this work, and that funding is out there. So just something to think about. You know, even if you have to replace, you know, parts of your facility that maybe are outdated, or damaged from environmental problems, this might be something worth looking at. But what we're going to talk about today is really the public assistance for disaster recovery. And this is the funding that we're probably all more familiar with, that, you know, when FEMA kind of kicks in after a disaster happens, and it's declared a FEMA disaster. So it's that public assistance, or PA funding. So in the last 3 years, my team submitted over $105 million in applications to FEMA for COVID-19 and environmental disasters. And of this, so far, 38 million has been awarded as of last week. That number, you know, increases or changes every day. So these are very round numbers, but just to say that we've been very successful in moving projects through the process, getting projects in the door, getting them pushed through. But it is a very slow and lengthy process, especially with the volume of work that was created for FEMA due to COVID. We've worked with 11 hospitals, 3 skilled nursing facilities, and 2 tribal governments. We also, of course, Moss Adams as a whole provides a lot of, audit and tax and consulting work to governments, be they, city and county governments, a lot of strategic planning, that kind of thing. But this is the work just specific to FEMA applications. We've also done work kind of around FEMA applications, I would say. For example, doing some pre-audit review, or just, reviewing FEMA-funded programs, making sure everything's in compliance, and, matching budgets as it's supposed to. So I just wanted to get into some key terminology, words that get bandied about by the FEMA folks and in FEMA guidance that is useful to know about. So the graphic on the right side of the slide just shows different types of work, different categories of work. In the COVID disaster, it's really all under category B, the emergency protective measures. But for something that's more environmental, like a storm or an earthquake, we would see permanent work, restoration of roads and bridges, water control facilities, buildings, equipment, utilities, parks, recreation, and other facilities. These are the types of public, facilities that FEMA wants to make sure continue working, continue running. So FEMA is the federal agency. The recipient, when you see the word recipient, that means it's the state agency or the tribe, and they have a direct relationship with FEMA. I think most of the folks on this call would represent applicant organizations. And this includes the private nonprofit entities such as hospitals or skilled nursing facilities. And it can also be a tribe. So a tribe can work through a recipient state, or a tribe can work directly with FEMA. And there's some pros and cons either way of doing that. There is the difference between a large project and a small project. So they previously had a large project threshold of around $131,000. They increased that to $1 million in August of 2022. The reason for that, of course, was because so many projects were coming in that were considered large projects because they were north of 131,000. And that just requires more documentation and a higher level of scrutiny from FEMA. So now with this new large project threshold, it just makes it so they can more easily process the small projects. The federal cost share, that's the percentage of the costs that FEMA is covering versus the amount that you, the applicant, are covering. And category Z, not listed in this graphic here, are the administrative expenses related to this FEMA application process itself. So in addition to the emergency protective measure costs or any of the eligible costs to respond to the disaster, there's also just the cost of doing the FEMA application, whether that's your staff spending their time on it or whether it's working with a consultant. There's some expense there. And we'll talk a little bit later. I have a whole slide about Cat Z expenses, but FEMA does cover a portion of those expenses. I have a link here to Grants Portal. I definitely want this slide deck to be a really useful resource to you. So you'll see there's links all throughout it that you can always use these to get to where you want to go. But the Grants Portal is essentially the central hub where you're going to submit applications. And I have here this alphabet soup of different acronyms that you'll see along the way. So the Disaster Assistance Program Specialist, or DAPS, is the person at the state agency that's assigned to work with you. This may be a contractor, or they may have an email address that ends with your state agency. In California, we have Cal OES, the Office of Emergency Services. That every state has their own, and it might be in Pennsylvania, it's PEMA. In Mississippi, it's MEMA. So it just depends on your state. What that agency is called. The PDMG is the Program Delivery Manager. That's the person in FEMA who is assigned to you and your projects. The Task Force Lead, or TFL, is their supervisor. And the PAGS, or Public Assistance Group Supervisor, is the TFL's supervisor. So you can see it's very hierarchical within FEMA and how projects kind of move up the hierarchy. And then the CRC is an important one you'll hear a lot. It's the Consolidated Resource Center. There are 4 of these throughout the country. I believe they're in, I know one is here in California, in Sacramento, which is relatively close to where I live in the Sierra foothills. But there's one in Texas, in Virginia, and in Puerto Rico. So everybody's projects get filtered through one of these 4 CRCs. And this is kind of the team of people that will probably send questions back to you. Okay, that was a lot. On this slide, I just have links to FEMA's some key guidance documents, but there are many, many, many more guidance documents than this. But the first one, top of the list, is the PAPA-G, the Public Assistance Program and Policy Guide. And if you ever hear anyone say PAPA-G, that's what they're talking about. If you say PAPA-G, you'll be ingratiated with the FEMA guys, because that's what they call it. That's their jargon for it. I had a clip art of Papa Smurf on this slide, but our marketing department wouldn't let me use it. But I want you all to picture Papa Smurf and know that this is the master guidance document. This is the most important one, okay, the PAPA-G. There's other links here to some COVID-specific guidance that's very useful for understanding the eligible expenses, but we'll get into that in a minute. Lots of questions come up around the timing of all this, and I wanted to just review all these important dates with you all. So January 20th, 2020, this is when the federal COVID disaster begins. And this is when the 100% federal cost share kicks in. So something very special about the COVID disaster is that that federal cost share, the amount that FEMA covers, is 100%, starting from January 20th, 2020, and going up until July 1st of 2022. That's a very long period. July 1st, 2022 is an important date because it's the deadline to submit the request for public assistance, or RPA. And this is the eligibility determining step. And you need to do this to make sure that your organization, whatever you are, whether you're a government, a district of some sort, a district hospital, or a private nonprofit hospital, this is the step that you're basically getting permission from FEMA to apply. On July 2nd, 2022, weird date, I know, it switches over to this 90% federal cost share, and that continues until the end of the public health emergency on May 11th, 2023, which happens to be tomorrow. So when we set the date for this webcast, we didn't know what the date of the end of the PHE would be, but turns out it's tomorrow. December 31st, 22 was an important deadline because that was the deadline to submit projects for that first period, the 100% cost share period. Don't ask me what I was doing between Christmas and New Year's last year. I'll just tell you real quick. I was filing FEMA applications because there was this big deadline on December 31st. So we got lots of applications in that week. Basically, things just continue on now until this May 11th date. This is when the costs should end. Anything you pay for that's COVID related after this point probably won't fit into one of these projects. But there is an extra 90 days until August 9th of 2023 to complete demobilization and disposal work. So I just think of this as kind of taking down the party, taking down the tents, cleaning up everything, whatever cleanup or disposal or storage kind of work you might need to do now, that can fit into this time period. Frankly, I don't envision there being a lot of this kind of expense for the COVID disaster, but just keep in mind if maybe you still had temporary facilities up or plexiglass and you're taking it down, you have until August 9th to get those costs completed. And then the next big important deadline is November 7th of 2023, this year, that's the deadline to submit projects that are in this second period, the 90% period. So everything from July forward to May 2023 is can be included in these projects due in November. They've also set May 6th, 2024, so a whole year from now, as the closeout deadline. Essentially, all projects, they will go through this. They go through a process to become obligated, but then there is a closeout process with FEMA. So this is when they want those closeouts to be completed. Honestly, a lot of that hinges on them getting all the projects either obligated or, a determination memo, which means not obligated. May 11th, 2025, 2 years from now, is the last eligible date for the Category Z management or administrative costs. So if you are continuing to work on these projects and kind of closing things out with FEMA, continuing to work with a consultant, those costs can be incurred for another 2 years from now. So that gives us plenty of time to keep working. There are opportunities. You can submit deadline extension requests. This is definitely subject to, your state agency's approval, and it really you have to have good reason for that, like extenuating circumstances beyond your control. But that is an opportunity. So with that, I'll hand it back to Amy for our next question, and I'll take a look at what's in our Q&A box here.
All right, thank you, Georgia. So the second polling question is, my organization was financially impacted by the COVID-19 pandemic. We had a lot of costs that weren't reimbursed by donations, governmental funds, or grants. And is that a statement that you strongly agree with, agree, disagree, strongly disagree, not sure, or not applicable?
We've got about half the people responding. So one of the questions that came in is, what states has our team worked with? And of course, Moss Adams works in all 50 states and all over the world. But for these FEMA applications, most of our applicants have been in California, although we've worked with others in Oregon, in Texas, in Mississippi, in Pennsylvania. I hope I'm not forgetting anyone, but those are kind of the main ones that are jumping out, but definitely a lot in California. And certainly if anyone on the line here is in California, you know that there's been definitely a lot of delay in getting those applications processed in California in particular. Definitely, it's been a good opportunity to see the variability between states. It's been very interesting. Okay, so definitely a majority and more than half either agree or strongly agree that a lot of financial impact from the COVID pandemic, and you have excess costs still that weren't reimbursed through any of those federal funds that came out. So thank you for that feedback. So this is a high-level overview of the application process. Basically, from the disaster being declared, usually there's an applicant briefing, whether that's in person or a webcast that's held by FEMA, just talking about the disaster and what's eligible and the timeline for that disaster. If you don't already have the request for public assistance, that eligibility step completed, you have to submit that before you can apply for funding. They confirm your eligibility. You may have an exploratory call or what's called a recovery scoping meeting with your contact at FEMA. And then you begin to draft your project or projects on Grants Portal, the application website. This is a step where, typically I'm pretty heavily involved in drafting the project on the portal. But ultimately, the applicant, you, needs to be the one that reviews and signs and submits the project. It goes through many internal steps at FEMA. There's, the CRC is sort of, I would say, the important one, where you might get requests for information, questions coming back to you. that you have to respond to by a certain deadline, and you submit your responses in the portal. You can also get what they call soft RFIs, where you might just be emailing with them about it, but a hard RFI is actually submitted through the portal. There are many steps of approval internal to FEMA that we can see status updates on the portal of which step it's going to. But we don't really do much. We're just kind of sitting and waiting for the project to kind of work its way through the labyrinth of FEMA approvals until I like to see projects get to a status that says pending final FEMA review. So that to me means that you've worked your way past many reviewers, many steps. It's really just in the final review phase. And we use the word final a lot of times here, but I would say you're in a really good place once you've got your project there. Once FEMA does that final review, they're going to send it back to you, the applicant, for one more signature before it gets obligated. And there could be a step in here if it's a large project over $1 million where there is like a public disclosure and essentially Congress is notified that you, the applicant, are receiving X dollars and it's over $1 million. I've never seen any harm come from that process or anything bad happen at that point. It's really just kind of a part of the process. So once the project is obligated, then you're very happy. That means they are obligated to give you this money, as it sounds like. But FEMA gives that funding to your state agency, and it's really the state agency that's going to disperse the funds to you. Different states do this different ways. This is one of those areas where there's a lot of variability. So, if you're in California, you are going to fill out 5 forms, one of those that needs to get board approval, and get those back to the state agency before they can disperse funds to you. Some other states actually require you to resubmit all of the documentation you gave to FEMA. Now you need to resubmit it to their portal for their state agency. And some states don't have any of that and seem to be extremely easy to work with, and they're just cutting you a check. So I would just say there's variety in how that process unfolds. There's also, I just want to mention the opportunity to submit amendments to your projects. Again, some variety between the states, whether they want you to do that or would prefer that you just submit separate projects. But if you have a project that's obligated and you have more cost of the same type, that could be an easy way to get that additional cost approved, is just submit it as an amendment to an obligated project. And then there is a closeout process. So once all of your projects are either obligated or have been not approved, they have a determination memo, you're going to initiate a closeout process with FEMA where they make sure they have all the documentation they need. And typically this includes the proof of payment that you actually paid all of the costs. Just to mention, the COVID disaster timeline that I reviewed previously is very different from what I would call a normal FEMA disaster. And a typical federal disaster cost share is 75%. So it's much higher for COVID, being 100% and 90% than what would be normal, for a storm or a tornado. I'm not going to look at this in too much detail, but essentially it's a much more prescribed timeline where you have 30 days to complete the RPA step. You have 60 days to identify your damages. You have 180 days to get your project submitted. So thinking about the COVID disaster, just sharing some guiding principles. Work for medical facilities, work needs to be necessary as a direct result of the emergency and directly related to the treatment of COVID patients. Had a lot of projects get kicked back because maybe it was an increased cost that was sort of roundabout, related to the pandemic because prices went up and supply chain issues, but it wasn't necessarily for services or items that were for caring for COVID patients. Cost reasonableness is very important to FEMA. They have what they call the prudent person rule. Basically, would a prudent person have bought this item or service? And of course, contract procurement's a big part of that. But basically, they just want to make sure they're not paying for anything that seems extravagant. It needs to be reasonable. It needs to be within your legal responsibility to do this work. And so that can maybe become an issue if you're providing services, to the general public at a off-site location. Maybe could raise the question of, should you be doing this, or is this really the responsibility of the county? Should you, a hospital, be doing this, or is it the county's job, or the city's job, or the public health department? Really, whose responsibility is this? But certainly providing medical care at hospitals is within your legal responsibility. This is just my personal preference and suggestion. I think it's a lot easier and makes more sense to submit FEMA applications for completed work, but you can do expedited projects with FEMA where you're submitting an estimate of the cost and they pay you half of it. And I think that would make a little more sense in the case where maybe a tornado really did hit your building and you immediately need an infusion of cash to respond to the disaster. But for COVID, just incurring the cost and submitting the exact details, I think is a lot cleaner of a way to submit these applications. So common expenses that we've been submitting include temporary or contract labor, employed labor, but keep in mind that only overtime and double time is eligible. You still submit all the data about the labor, regular time, and lots of details there, time cards, but only the overtime cost is going to be eligible for FEMA. Certainly supplies, lots of supply expense. Tomorrow is the last day of the disaster, but just keep in mind supplies need to be used or distributed by this date, May 11th, 2023. So don't go out and buy $1 million worth of masks today because FEMA's not going to pay for that. Okay, unless you use them all today. But keep that in mind. It's what's supposed to be used. COVID diagnostic tests, certainly for employees, most of the time these are unreimbursed. When it comes to patients, a lot of those tests were paid for by the patient or their payer. So you have to keep that in mind that you're not, requesting duplicate expenses from FEMA. Rented equipment, ventilators, freezers, air scrubbers, really common. Capital equipment, if you purchased anything, and just have to keep in mind there's a disposition requirement here where we're looking at, is this item, the fair market value of the item, more than $5,000 at the closeout of the project or the end of the disaster. So this can be a little bit difficult to figure out or to prove what that remaining value is if it is a high value item. But just keep that in mind, capital equipment is eligible. Temporary and expanded facilities, a lot of costs related to doing these drive-up tents or triage tents outside of hospitals, and things like signage and communications, and even promotion of the vaccines or vaccine clinics, really common expenses. Some expenses to avoid, definitely lost revenue. That's the biggest question I get because of the HRSA Provider Relief Fund. I've also worked with 100 or so clients who had to do this PRF reporting and received these funds. And what's great about PRF is you can use it for lost revenue, but FEMA funds are not like that. So FEMA is very tangible. Just keep in mind, they are used to dealing with three-dimensional disasters and three-dimensional costs. And that's really how they function the best, is when you can hand them a stack of invoices and say, this is what we bought. Here are the items. That's going to always be the simplest thing for them. From the beginning of the disaster, FEMA kind of advised against submitting costs for IT and software and work from home equipment. That's really just kind of, in their perspective, an increased operating cost and not really an emergency response cost. There could be some exceptions to that, but generally, avoid those costs. The employed labor, the regular time will not be eligible. And also I've seen this quite a few times where folks have created a new disaster pay category that, was incentivizing your staff to stay on, even though, maybe volumes were higher or, there were COVID surges. But since these are newly created after January 20th, 2020, when the disaster began, FEMA can't cover those. So they're kind of off the table. And then duplication of benefits, very important to keep in mind. Thinking about any costs you submit to FEMA, just like with PRF, was there any other source of funding that would have paid for that covered that cost? So was it covered by someone else that shouldn't be going to FEMA? Documentation is very, very important to FEMA. In general, every project will have a cost summary document where you're listing out all of the expenses on the project. And then really just depending on what's in the project, you might have some or none, I guess, but probably some of these expenses, but not all of these different kinds of documents that go along with it. So it's invoices, contracts, policies, including your compliance policy, your payroll policy, could be payroll records and time cards. Certainly by the closeout process, you'll want to provide proof of payment. If you had capital equipment, coming up with that fair market value of that CapEx. There are oftentimes environmental and historic preservation questions that come from FEMA that folks are a little unprepared for or just seem a little weird. But things like the date of the building construction, how materials were staged or disposed of, how signage was attached to the building, whether it was screwed in or taped on. I know FEMA wants to know that level of detail about that. I really encourage you to take photographs along the way of any temporary facilities or signage you put up, include site plans, and know if you have any special designations. So just working with your environmental services manager is important. If you had any communications with government agencies, make sure you keep those emails or letters. If you're doing a project for PPE, you'll need to show what your PPE inventory tracking process was, kind of describe how you receive and monitor and distribute PPE. We usually do that just kind of in a narrative, but if you have some policies around that, that's great. Or if you have reports that show inventory, that's the type of thing they want to see. Basically, they want to know that you're buying these large quantities of PPE, but you're also keeping track of them. Something really important too, on all documentation you submit to FEMA, you'll need to redact any HIPAA covered information, such as personal health information. They also do not want to see any bank account routing and account numbers. And also tax ID numbers. And this comes up a lot on invoices where the vendor puts their own tax ID number on it, or they put their bank account to remit the payment to. Had our staff spending quite a bit of time redacting that information so we can get the files up to FEMA. And they'll send it back if they don't like it. All right, Amy, our next question is up.
All right, so our third polling question is: a successful FEMA application might include, and your options are list of all costs, invoices, contracts, payroll reports and time cards, compliance policies, or all of the above. And just a reminder, if you would like to receive CPE for today's webcast, you will need to respond to at least 3 of the 4 polling questions.
I'm just taking a look at some of the questions in the chat box. So I do see someone asking about, of the projects that we've been involved with, when we say, 35 million has been awarded, where they're asking about, was that money that's actually received by the states or was it obligated? So that number is obligated funds. Although I will say the majority of it has been received from the states. It is a little bit of a slow going process, though. That's, getting from obligated, which is great. You want to get it obligated, but actually getting check in hand can definitely be a little cumbersome, just trying to get all of your documents into the state agency and having them process that. Okay, very good. I think everyone here, nearly everyone's on the same page that, all of the above, these are all important documents. And really just to say that FEMA is very documentation heavy. These applications want every cost documented and justification, and there's a lot that goes into it. So talking about contract procurement, essentially, FEMA just wants to verify that you are following your own organization's written procurement policies. So that is very important. But I do have a link here to the exception to the rules during emergency or exigent circumstances. And these do allow for sole sourcing contracts. But, when it comes to other types of work that's not happening in the emergency, they're very specific about, the terms that are in the contract and the process that you, procure the contract. It's important to them, and I definitely recommend reviewing these regulations, and also kind of keeping some of these terms in your contracts, demonstrating that you're regularly reviewing the costs, that these are necessary and reasonable costs, that kind of thing. And contract procurement questions definitely will come up in your application. I would say it's not to say that if you don't have a contract that it's out the window, because we've definitely worked with FEMA especially in this COVID emergency, in explaining why some vendors we may not have contracts with, or may not have perfect contracts with, or maybe there was a gap between one contract and the other, but here's the reason why. So, you can work with them and they're reasonable, but just know that these questions will come up, and the more airtight process you have here, the better. Duplication of benefits has definitely been a thorn in our side for a while with these applications. So basically, FEMA is prohibited from providing financial assistance where such assistance would duplicate funding available from any other program, insurance, or other source for the same purpose. And that makes sense. The federal government doesn't want to pay for something that's already paid for by someone else. But it's very confusing for hospitals, and when it comes to providing medical care, because of the way that you get paid, it's very, very hard to prove that a specific expense is or isn't paid for by the patient or their payer, the insurance, when you're using DRGs, diagnosis-related groups. So it's and even other things can really complicate this, like capitation payments. It's just sort of it's not a normal type of service where you just pay, fee for service, exactly one item for another item. Or, one you pay $1 and you get a service. So this was really, really hard for FEMA to understand healthcare billing and reimbursement. And there were a series of, feedback opportunities that were given, and a webcast. And finally, in October of 22, this guidance document came out that I think is very helpful. It's not perfect, but it definitely kind of pointed FEMA in the right direction. So basically, they kind of distinguish between costs that have a high likelihood of generating revenue and those that have a low likelihood of generating revenue. And those ones that have a low likelihood are, I would say the low-hanging fruit of what to apply for with FEMA, because you then don't have to really prove anything about duplication of benefits. The ones that have a higher likelihood, for example, just medical care, labor, your traveler nurses, that you're going to have to prove that your revenue did not exceed these expenses. Definitely, everybody needs to provide their own their own calculation. I have here kind of outlined what I think is the simplest way to do it, but it's basically looking, at a category of expense as a percentage of revenue in 2019 and saying, okay, this is the expected percentage, and then looking at the percentage of revenue that expense was in 2020 and beyond in the pandemic years and saying, okay, did it exceed the expected amount? So definitely that's an important calculation to do before you submit your projects. Category Z management cost, as I mentioned before, this is for the administrative expense of actually doing the work to make these applications, gathering documentation. It could include, travel costs if you met with FEMA, or office supplies or equipment, but typically it's really just the time spent working on this. And this is for your own staff, if they're recording their time spent on this, and of course, any consulting cost you incurred during this process. So this can be up to 7% of the total obligated amount that goes to the recipient, the state, and then they pass through up to 5% of the total obligated amount. So this really has to kind of wait until you're done with all of your projects, whether they get obligated or not obligated, but just take that total obligated amount, and then 5% of it is the maximum you can apply for Category Z management costs. And you do not automatically get just 5%. You would still have to show the documentation that, of people's time spent, the date worked, what they worked on, basically a listing of activities of what the administrative work was, or costs if there's supplies or equipment or space involved too. There is an appeals process available. If you receive a determination memo, which is rejection, you can appeal that, and definitely work with your legal counsel to do that. And also know that it might go into public record. So just keep that in mind. I don't know how private any of this really needs to be, but just something to be aware of. So last few minutes, I'm gonna talk about pro tips. Definitely the FEMA folks get deployed to disasters for a limited amount of time. I think it's usually like a 90-day window that they get deployed. So expect some turnover from the people you're working with, both at FEMA and the state agency. And just remember, that's a super important relationship to cultivate. You definitely want to have good relations with those people and be responsive to their emails. For many of my clients, I have a monthly or even a bi-weekly meeting with those folks to make sure that, we stay on their radar, we're at the top of their list, and they're moving our projects forward, and have some accountability around that. I think almost everyone did this instinctively, but make sure you have an expense category for your disaster. That'll make it easier to keep track of what expenses were related to the disaster and rely less on memory, of course. And make sure you train your staff to keep using that until the disaster is truly over. I know with COVID, things felt like the new normal, as they said, probably even by the end of 2020, and people stopped using these categories. But, it goes until May 11th, 2023. So you want to keep tracking your expenses. Definitely recording as much as you possibly can in real time is very important. What was damaged, what you purchased, why you did it, as much detail as possible, and take photos of everything. They will come in handy, and especially if nothing else, to jog people's memory about, what costs were incurred or what was happening. I also recommend you get policies in place before the disaster. So something we learned about, I mentioned before, was having a hazard pay or a critical need incentive pay for workers to keep them working during COVID. If you had that in place before the COVID disaster, just as a general, hazard pay policy, then that would have been something FEMA could pay for. But if you did it after the disaster kicked in, now it's not eligible. So I would just say if you could put in a policy like that now, that's a really good idea. Also, as just discussed, the duplication of benefits ceiling, just calculating that and checking that before you put a ton of time and effort into a project is a good idea, because these projects do take time and cost to develop and get in the portal. But if you do all that work and then you figure out, oh, actually, we had more than enough revenue this year to pay for our labor cost, then you just end up kind of losing the project. So I would say it's hard to have done that in this COVID disaster because they didn't come out with the guidance till October of 2022. But at this point, we have the guidance, so we can do that confidently. Also, if you're in Grants Portal already and you have projects in there, you might not know this, but using the little lightning bolt graphic or logo at the top, you can subscribe to your project, and every time a status update happens, you'll get an email about it. You may or may not want all those emails, but if you would rather get emails than have to log into the portal every day and check on it, you can subscribe. Another important thing is the sam.gov registration. This is the System for Award Management. This is where you can find your unique entity ID number. This is a number that was, it used to be called the DUNS number, but has now been replaced. I would say probably all my applicants find that their SAM registration's not up to date, or maybe they don't know who is connected to this website, and you have to kind of go through a process to get reconnected to it. So yeah, I definitely would say make sure that your sam.gov registration is active, and it's something that does need to get renewed every year. Yeah, I think I've mentioned this before, but the state agencies have varying payment processes, so it's not going to be the same. Don't expect to get the dollars on the same day that your project becomes obligated by FEMA. There's still, another step there to get the money. Definitely recommend having either a temp or administrative assistant on your team pulling documentation, since that can, be a lot. There could be hundreds or even thousands of invoices and contracts that you need to pull down. Make sure, you have someone on your team that has access to files and can do that for you. But I do recommend working with a consultant on the project management piece of this, because there is a lot that goes into putting the applications on the portal, getting I like to get as many answers in there preemptively as I can so that we don't get asked the question, we're just answering it up front. And, just managing that relationship with the agencies. And just be patient, of course, because this all takes a lot of time and is paperwork. But, like I said, I do feel like there's a really high success rate as long as you're using eligible expenses. You will ultimately be successful. Okay, last question. Amy, I'll hand it to you.
All right, so the last one is, would you like support with FEMA applications related to a disaster or preparedness mitigation grant? Yes, let's talk. No thanks, I'll wait until disaster strikes. We have FEMA related support already, or not applicable. And hopefully we can move through this one quickly so that we can have more time for Kimberly with the audit considerations.
We've got about half the answers in. One person asked, I just wanted to confirm the large project threshold. So the large projects are more than $1 million. The small projects are less than $1 million. Okay, so we'll keep going. And I'm going to transition it to my colleague, Kimberly Sokoloff. I didn't leave you with a ton of time, but please let us know about the audit considerations.
Absolutely. Thank you, Georgia. I want to briefly touch on audit expectations so that you can prepare for the ultimate audits that may come after you have received your FEMA award obligations. The audits may come from multiple sources. The federal government agencies themselves are permitted to audit the FEMA award compliance. Additionally, not-for-profit organizations that receive and expend greater than $750,000 of federal awards during a fiscal period are subject to a compliance-focused single audit. And I do want to specifically mention that if the FEMA awards that you receive approval for and expend fall below the $750,000 threshold, but if you've received other federal awards and in total, your federal awards that you've expended exceed that $750,000 threshold, you would be subject to the single audit. Those are due 9 months after your fiscal year end, and they are evidenced by submitting the single audit report on the Federal Audit Clearinghouse website, which is a public repository, and they are certified by both the auditee organization and the auditor. We've included 2 links that I won't go through right now, but these are available for you to review. They provide tips on project management and then OIG findings during audits that they have performed so that you can review that. For the single audit each year, the Office of Management and Budget produces a compliance supplement that guides the scope of the audit work for specific federal awards for the single audit. What I've shown here on this slide are the specific compliance requirements for the FEMA awards under the 2022 compliance supplement. The most time-intensive part of the single audit would fall within the first 2 categories: activities allowed or unallowed and allowable costs. In these areas, the auditor will be testing whether the cost did comply with the terms and conditions of the FEMA awards, including whether the costs are directly tied to the performance of eligible work, whether the costs have been adequately documented, whether they have been reduced by applicable credits, including consideration of the duplication of benefits that Georgia touched on earlier. And then FEMA does have specific reimbursement criteria for labor costs, which will be subject to testing under these first 2 components. The sample sizes for the single audit for these first 2 components can be somewhat sample intensive, depending on the amount of invoices or labor charges that are included in your FEMA application. The sample sizes could range from 40 to 60 for general disbursements, and even more than that if you do have labor components in your application. Matching, Georgia touched on the federal cost share minimums, and those did change throughout the duration of the pandemic, so that will be subject to testing in the single audit. And then FEMA or the sub-awarding agency may have periodic reporting requirements. If so, please retain that documentation, including evidence of whether somebody prepared and reviewed that reporting. Those will also be subject to the single audit. Just for fun, as I mentioned, the Federal Audit Clearinghouse website is a public repository and is searchable. This morning, I did look at how many single audits have been completed for FEMA awards in the past 3 years. There have been 1,700 single audits completed over FEMA awards, and of those, about 13% did have findings, whether they were non-compliance-based findings or control-related findings. And then finally, these are some audit considerations, many of which Georgia had touched on to set you up for success in future audits. I'll highlight the last one. The single audit, not only does it test for compliance with federal awards terms and conditions, but also whether the organization had effective controls over compliance. So encourage you to maintain documentation as far as any reviews and approvals of reporting and reviews and approvals of costs by an individual that is knowledgeable about the grant's terms and conditions to evidence the controls in place over the grant compliance. And with that, we received a lot of great questions in the Q&A, many of which we did not have time to go through live. We will be reviewing those and responding to you. Please feel free to reach out to Georgia or I for any additional questions. Our contact information is included in the slide deck. And with that, I'll turn it over to Amy to conclude our presentation.
All right, thank you, Kimberly, and thank you, Georgia, for a really great presentation today. And I do want to mention to the audience that our annual Executive Healthcare Conference will be this November in Las Vegas, and registration is now open. There is an image in the upper right-hand corner of your console that will take you to more information, so definitely check that out. And if you met all CPE requirements, your certificate is available to download now in the CPE progress window. A copy will be emailed within 2 weeks if you have difficulty downloading it now. And finally, here's a link to an online survey for today's presentation. And thank you for joining us. Take care, everyone.